Hello, so my name is Pharmacist Chi. I'm here to talk about vaginal infection. I have noticed that a lot of women always have this recurring vaginal infection. It's common. Some people don't even know what to do about it. Some people are tired, they don't even know where they get it from. Vaginal infection is something we underrate, but it's everywhere. You're spreading it from one person to another. And some people are confused. So let me give an example. Like I have this friend, she has this vaginal infection, is always recurring. Should I say recurring vaginal infection? Yeah. So she chatted me up and said, okay, what we should do, that she has been taking drugs. She has been taking drugs and she has not been sexually active. And she has been taking drugs for some months now. So she doesn't know what caused it. I was like, okay, you've not been sexually active, so what caused it? What kind of toilet you use? What is your hygiene like? So before we go into this, there are different types of vaginal infection. They have the bacteria. We have the bacterial vaginal infection, and then we have the fungal infection. Then we also have the STIs, that's the sexually transmitted infection that can also occur. Now, what are the symptoms you get from vaginal infection? You have discharge, it can be colored, it depends on the color of your discharge, smelly, itchy, and so on. So if you notice you always have recurring vaginal infection, first of all, what you should do is you see a specialist, you see a pharmacist, you see a professional, you see a doctor, carry out tests with the doctor's advice. After carrying out the tests, you make sure the test gives you, okay, so you make sure from the test you get the best fitted drug to use. You do the sensitivity test. So once you discuss this with your doctor or pharmacist, they will read the test and then tell you, okay, this is a combination of drugs to use depending on how severe it is. Sometimes when it's severe, we can do one or two combination of the drugs to avoid interaction. You don't do it yourself, because once you take one or two or more, you might have side effects of these drugs. So, but with a professional's advice, you get to know the best combination to use, reduce side effects, or without side effects. So, after carrying out this test, after taking your drugs and you feel relieved, do another test. Do another test to make sure it is not there again. You carry out another test to make